Here to discuss the top accomplishments in cancer research in 2021 is Dr. David Spiegel.
Dr. Dax Kerbegov.
Welcome, Meredith. Welcome to the show.
Chief Scientific Officer at the Sarah Cannon Research Institute.
He is the Vice President of Clinical Programs and Outcomes at the Sarah Cannon Cancer Institute.
The Sarah Cannon Research Institute.
Dr. Erica Hamilton of the Sarah Cannon Research Institute. Thank you so much for putting that great news into context.
There have been some breakthroughs in the last few years, specifically something we've talked about on this program before, something called immune therapy. There have been great strides made where we now have 2 therapies available for treatment in addition to chemotherapy. So real advances and more hopefully coming.
2 years ago, Victoria learned about a revolutionary new sickle cell treatment that had the potential to change her life.
When we put these cells back in patients, can help mitigate the sickling in the red blood cells and eliminate the complications related to the disease.
It's been almost 2 years and I haven't had a hospital stay or an emergency room visit. So that's big for me.
We actually made a small crack in the door, and I hope that what we have shown here will open the door wider to target more diseases.
Really important in the last 10 years has been progress made in treatments, new types of treatments, including immunotherapies that unlock the power of the patient's own immune system, and targeted therapies that can be given in very personalized ways are translating into better survival, better quality of life, and overall better outcomes.
Researchers are finding fewer Americans are dying after being diagnosed with cancer.
We saw a decrease in 11 out of the 19 most common cancers in men and 14 out of the 20 most common in women. And so the parting message I would want to leave is make sure to stay up to date with your doctor's visits and your cancer screenings.
Now, mRNA is a protein, and now doctors are hopeful that what we've learned from these vaccines can actually help cancer patients.
The idea of being able to use mRNA has greatly sped up the development of potentially personalized cancer vaccines. And so personalized cancer vaccines have been an exciting opportunity for patients, either patients with early or late stage cancer.
Can you develop a vaccine to teach your body to target, in this example, cancer? So a lot of work that was happening before the pandemic has been accelerated because of some of the advances with fighting the pandemic are now coming back to helping us fight cancer. So really exciting time.
The name of the drug is trastuzumab deruxtecan, and it's specifically a drug that's targeted to HER2 positive breast cancer, one of our 2 most aggressive forms of breast cancer. What was very exciting in this trial is that we've been able to get the rates of interstitial lung disease, serious rates, down to less than 1% now.
New treatments are being developed that could allow anyone with sickle cell disease to lead a symptom-free life.
We are currently treating patients with sickle cell disease and beta thalassemia using a innovative therapy called CRISPR-Cas9 gene editing. The 7 patients that received this treatment all have benefited from it and have not experienced any sickle cell-related complications after the treatment.
Now, new data on a new drug is offering some hope.
Trastuzumab deruxtecan, or Enhertu, is one drug in a new class of medications called antibody-drug conjugates. And that's a way to get chemotherapy just to the cancer cells by a honing mechanism called an antibody. It's advantageous because it targets cancer cells and leaves the rest of the body alone, which translates to less side effects for patients.